we were waiting on the pathology to come back, so I want to come chat with you now that we kind of have some idea of what's going on. I'm just going to get this remote.
What's the blue? Where's the blue?
Blue what?
This remote
TV?
doesn't work.
Yeah,
The TV?
the TV remote.
Here.
Oh,
Thanks. All right, so I know the gastroenterologist came by and spoke
Yeah.
with you, right? So, just to kind of make sure we're on the same page, I know you came in with abdominal pain. They
Right.
found that you had low hemoglobin.
yeah.
They did some scans, and those scans revealed that you had some masses on the ovaries, some additional kind of thickening in the abdomen, and then near the sigmoid colon. They did do that endoscopy from the top.
Yeah.
Initially, they didn't find anything there, so then they went for that thickening that they found in the sigmoid colon. The biopsy from that just came back, so we don't have final pathology, but we have a prelim, because we were waiting to differentiate, is this something ovarian, or is it something that started in the GI tract, which is what we were suspecting.
Yeah.
So I came back showing something called signet ring carcinoma. It's a pretty aggressive cancer. We think it's arising from the colorectal area,
Okay.
but we are waiting on some additional stains that the
Am I dying then?
This is not curable.
Okay. All right. All right.
What's the life expectancy?
Well, it's hard to say. With normal colon cancer, patients usually can live a few years.
Okay.
But there are a lot of changes coming, so sometimes we're doing even better than that.
Okay.
Now, the signet ring features generally are more aggressive than a typical colon cancer. So, obviously we don't have a crystal ball, right? There's no way to predict for
Yeah.
any one person. You're young, you're
Yeah.
able to tolerate treatment better than older folks.
Yeah.
We're going to still send off some special testing if there
Yeah.
are certain features that tell us that maybe this tumor can respond to immunotherapy. Those
Oh.
patients do even better.
Right.
So I think we don't have enough information to quite give you a better idea about prognosis yet. And, you're young, so I think you'll be able to,
Go for a year or so.
I think, well, again, there's no way to know,
Yeah.
but I think we would be very aggressive in your case.
I don't want to go through a lot of treatment.
Are there special trial things that are just coming out that she could sign up for?
I'd rather just go for it. Enjoy my life now, and yeah. I don't want to go through all that shit. And,
We don't have anything here. I don't know if, say, Mayo has any trials, but I think if you want to start treatment, you should probably start pretty soon, because that mass is almost obstructing your colon. And if you become obstructed, that can lead to a lot of issues.
So what would she lose
fine.
her hair then? What kind of?
Yes.
yeah,
Okay, so it'd be
I'm just gonna go.
you're just gonna die.
Yeah. I'm not gonna freaking.
Well, it's gonna.
I know this is a
prolong-
lot to hear right now, okay?
I'm not
I know
gonna prolong the inevitable.
there's a lot to process right now,
Yeah.
right? But, I think you're going to need a little time to digest it. The thing is, if you let it go untreated, right, there can be a lot of issues that pop up, too. Like obstruction.
Yeah.
Well, then, if that's the case, you should go with a stent right now. When they're saying that you should wait on the stent,
Well, I don't want to go through all this and just die.
it sounds like
I want
it's
my quality of life.
well.
Sure. Well, part of giving chemo is not only to prolong life. I mean, some patients...
I want to sit in bed and do nothing.
Some people tolerate... Well, won't necessarily be in bed. If the chemo is doing that to you, then we would stop it, right? Because we want you also to have quality of life.
Yeah.
But
I'm not gonna live out my life in a bed.
and that wouldn't be how you would live your life on chemo.
Or without my hair. Come on, I just need my hair.
Again, I think you're still processing it. I think there are a lot of things you have to consider, right? Hair versus
I know.
like significant abdominal pain, right?
Yeah.
Like, I'd rather
Well,
lose the
yeah.
hair and not have the pain, right?
When they're saying
So,
send her home, and just now after hearing this, it's either you start chemo immediately,
Well,
or you get a stent or a colostomy.
not necessarily, I mean, within the next couple of weeks, we should start. If you want something done now. I'm usually all for trials, right? But trials can significantly delay the start of treatment.
And as aggressive as her situation is, she needs to start a
I
lot
think we've got to
sooner,
knock it down fast.
fast.
Oh.
And say it did somehow, it was a miracle, and it wiped it out. I mean, how long could she live?
I mean,
Well, I don't think I have very long.
What?
There's no way to know. There's
I only
really,
have a year or so. Why
There's-
not enjoy my life?
I-
There's no enjoying when you blocked up and all of a sudden you got emergency
Yeah.
colostomy.
I don't. It's something I think, for quality of life purposes, I think something needs to be done soon. Whether
Okay.
that's a stent or a surgery or starting chemo. Because once you get obstructed, you can perforate. And that's going to be
Major hospital stay.
or death within a number of hours if you perforate.
Painful death.
If I prefer.
Yes.
Painful
if I prefer.
death.
No, perforate, she said.
I know.
Perforate, yeah.
I'd rather just prefer to go if I'm going.
You need to start chemo immediately. And you need to tell her that right now.
I think maybe you need a little time to process it.
Right.
I mean, certainly we want to respect your wishes.
Yeah.
How soon
Right.
could we start chemo?
Well, it depends on whether you want to do it. I mean, normally this type of chemo we don't do in the inpatient setting. We also are still waiting on final pathology, right? If some of this
Right.
pathology comes back showing that you would be a candidate for immunotherapy, right? Then
What is that?
that is a treatment where we use your body's own immune cells to fight the cancer.
And that's got a better prognosis than,
Usually, yes, if we can use immunotherapy.
and it just depends on the final pathology.
Yes,
And
which
how
can-
common is it that we're able to use that?
In colon cancer, not very common, somewhere around 6 to 7%.
Uh-huh.
But it's still something we have to wait on before
That's our miracle cure right there.
before we can recommend something.
Right.
And how soon before we get to final path?
That probably won't be till early next week. Because right now we just have the preliminary.
Okay.
I think it's probably best if you stay in the hospital. I know you want to leave, but
Just for the weekend, I'll leave.
well, we don't really, do that. Discharge and readmit generally, unless you're being readmitted for a surgery or something. But
Okay.
Okay, so you're saying she should stay here.
I think, what have your stools been like today? Have you been having bowel movements?
Just a little bit.
Is there
Just
any
a little-
blood?
No.
Are you passing gas?
Yes.
So a little bit as in like are they like pencils or like?
Yeah. Just a little.
And does it hurt to try to have a bowel movement?
No.
She's been getting Miralax, so
Yeah.
that's been helping a lot. But it sounds like what you were saying earlier, Patty, that is very, very tiny little
Yeah,
squares.
just
It is,
little.
okay.
Yeah,
Yeah.
yeah.
The colorectal surgeons weren't they didn't recommend 100% remove a stent or surgery right now, but they certainly were quite concerned that you could obstruct. You're at very high risk for obstruction.
Oh.
And I think, you know,
Well,
Well, after hearing that, I think,
what do you think?
and
I
then-
don't know, but I don't like what you're saying. I think you should be more positive and hope for immunotherapy and go down the chemo road sooner than later.
I'd rather just.
It's a hard.
You
don't
just
have to
want to
make
go
a
home.
don't
You don't
have
want
to
to base the rest of your life on
I'd
going
rather
home
go.
today.
I'm going to send your tumor off for more extensive testing too. We're
Okay.
going to test several hundred genes to see if we can find something we can target as well. That's going to take a couple more weeks. But in the while that's
So
happening.
you're saying we wouldn't even start chemo for 2 weeks anyway?
No, I think we would start what the standard is, and it's actually a triple drug combination.
That really wear my body out and everything.
Again, you're young. I think you'll tolerate it better than most folks do. It's not going to be a walk in the park by any means, but it will not make you bedridden. Like if chemo is making you bedridden, then we would stop it. Like,
Okay.
Chemo's making you what?
I want to get up and go
bedridden.
outside.
And remember, Patty, at any point you can say, I don't want it anymore.
Right.
So you have decisions. I think what Dr.
Ferris.
is saying is she just give you a big, diagnosis right now. And it's totally okay if you want us to just leave you alone and to just digest it,
Yeah.
process it, and see what it is that you want and what you need.
Okay.
Well, I know what she wants. She
And
doesn't
again, we
care
don't-
about anything but going home right now, and that's fogging her brain right now.
And we
Because
don't
it's-
have all the answers yet either,
Right.
right? We're still waiting on more data
Right.
to come in.
I don't think I want to go all week in here.
I mean, here's the thing: if you do
I'll
leave,
yeah.
if you leave, right, you just if you're having excruciating abdominal pain, if you cannot have a bowel movement, you have to come back. But it'll be through the emergency department, okay?
And all that nightmare. again.
And no, that's never ideal. I'm gonna have my nurse navigator get you set up to come see me
Okay.
in clinic next week. The only thing, that would be ideal to do while you're here, if we can get it done, is to get a port placed.
Yeah, that would be.
If we need to do that, but, until I know what the final pathology is, I don't want to place a port, right? Because
Right.
if you qualify for immunotherapy, you don't need a port.
Oh, good.
If you need chemo, then you need a port. So that's just like another,
How many days?
So the chances of survival, if we can do immunotherapy, greatly increase?
yeah, they significantly increase, yes. Patients can live several years. Again, that's a rare find if we find it,
Yeah.
but
And what would dictate that? Gene testing?
yeah. We're going to be looking at certain features from the biopsy. Something called microsatellite instability.
Okay. I'll have to think about it.
Okay. Yeah,
Okay.
you absolutely
Yeah.
do not need to make any decisions
Okay.
right now. There's a lot of
Okay.
information to digest. Are you able to eat? So is
Yeah, I
she
was thinking
soft-
on eating.
She's
yeah.
been NPO since yesterday, so yeah.
Okay.
Yeah.
And any nausea or vomiting?
No,
Any abdominal pain still?
right in here. It's
You're feeling
gone up.
something there.
Yeah,
Okay.
it's gone up.
So your recommendation is for her to stay in the hospital,
Yeah, I think until we have more answers,
which would be like next,
probably early next week,
Like
and then
Wednesday
we can kind of
then?
decide on whether to place
I don't want to stay here all. When I'm feeling good.
Is the plan to discharge after?
So Dr. Spencer from GI said that as far as her standpoint, she can go
She
because
can
the
go.
X-ray showed that she was not impacted.
As long as, return precautions and
Right, but
you
yeah,
get going
and then Dr.
quickly.
Lee came a little bit before you came and said that she's okay with you leaving. However, remember she was saying that,
Yeah.
like Dr. Ferris said, any kind of issue with nausea or increased pain, you need to come immediately, not wait.
Okay.
Yeah, so that's kind of the risk that you'll be.
Will they give me any painkillers to bring home? Just like.
Yeah,
I
they
haven't-
should. Yeah.
does it hurt really
I
that
think
bad?
will.
It must if you're
It's just,
asking
you
for-
have to, the painkillers are a little tricky, right? Because they can make you, they can slow down your GI system
Oh.
too. And then they
Yeah.
can make you
Stay
constipated. and
off
that
of
can-
that as much as
Yeah.
possible
Yeah.
unless you absolutely need them. Is it
Right.
excruciating?
Well, right
I mean,
now
if you're
it is,
saying
because
pain
I think I'm
7,
stressed.
Yeah.
I mean, if I was in like my shoulder the other night, it was definitely a 12. So if you're not a 12, I wouldn't even take the pain pills.
Well, I mean, this is something real that's going on with her, so it's like it's trying to find a balance. I mean, so that she's.
Yeah.
I mean, that, like you said, with quality of life too.
Yeah.
We don't want you excruciating in pain,
Right.
but to also be aware that there's a chance of constipation and slowing your bowels, right?
Yeah.
When you take.
Yeah.
And know, Patty, once again, this is just an initial conversation.
Yep.
Let us know how much time you need, okay?
Yeah.
So
I
if you
will.
need, I can get you some pain medication here in a little
Yeah.
bit. Let you sleep and just think on
Yeah.
it.
I think
Well, it
that-
really
that's
makes
good.
no sense to stay here if we're not going to do a surgery and we're waiting on results. That's just 5 days.
So what Dr. Ferry was saying was the benefit of staying here is she's still at a high risk for being impacted. And if she's impacted, that's something that would be in a true emergency. And that's the
Right.
benefit of being here in the hospital. We can get
So you
things
think
going
it is a
very
high
fast.
risk?
Very, yeah.
that she
Well,
may
Yeah.
impact.
Right?
I do defer to my surgical colleagues because they're the ones that deal with that. It's just on my end, we would probably be able to expedite getting you ready for chemo too, things like a port place. But we can always just do that as outpatient too.
Right.
But I would need to see you in clinic next week.
Right.
Okay,
Well, let's just
so
schedule that appointment right now and we'll go home.
well, I don't have the ability to schedule, but I will give you my card. Okay, I'll give you a couple of these cards.
Can I call them right now and schedule something?
I should have. I think my first opening is on Wednesday, so yeah, I can have them. If there's still any staff left when I get there, there won't be anyone there at this point. We'll have to get you into that slot on Monday.
Okay.
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 All our schedules
Yeah, I
go
just don't
home
want. I just don't
4:30
want to
on the
lose.
dot.
I just don't want to lose that slot
Yeah,
on
no, you
Wednesday.
won't. I'll have them hold it.
Okay.
Okay,
you're,
I'll
you're
have.
gonna have it held.
Yeah, and I'll have Jess Steinke, my nurse navigator, give you a call to just kind of touch base, and she's going to be a very good resource to help navigate you through all this, okay?
Okay.
But by that point, we should have all of our pathology back. But again, we just got to move fast because I don't want this to grow more and obstruct. So,
Right. Right. Okay.
okay.
Okay. We'll do
So
something then.
we will plan to see you next week.
Okay. Thank you.
All right. Well, it was nice to meet
Yeah,
you.
nice to
Again,
meet
I know there's probably a million
Yeah.
things going through your brain right now.
Yeah.
We'll be able to have a more